everybody. Thanks for tuning in. I'm Yolanda Chu, real estate specialist with Home Life Bestseller. I have someone very special to me, Dr. Pirzada. He is one of the best doctors, ER doctors I know. Welcome, Dr. Pirzada.
Thank you, Yolanda.
How are you today?
Good. Busy.
Busy? Okay, so why don't you
Told we might be getting the shot soon, so I'm just refreshing my email every 10 seconds right now.
Okay, so why don't you introduce yourself and tell us a little bit about what you do?
So I'm an emergency physician and chronic pain physician. I practice in Toronto, and I work in mostly critical care, emergency care. So I'm seeing a lot of COVID up close and personal.
Right. So why did you choose to become an ER physician?
You're going to laugh. There was a TV show called ER back when I was in high school. I thought those
Okay.
people were the best. They seemed like they really knew what they were doing. But it's really an exciting job. Like most days are never dull. You have a lot of variety in what you do as well.
All right. So every day is exciting. Every day is like something new. What are your primary duties and responsibilities as an ER physician and a chronic pain doctor?
So mainly in the ER, it's to get people through the door and out alive, hopefully.
Okay, fair enough. Uh-oh.
Sorry, got it. Send them to a department where they can be dealt with better. Like initially, you need to stabilize, diagnose, and then arrange for transfer after. And then for chronic pain is basically to see all kinds of patients who've had accidents or surgery that's gone wrong, and then try to find the right combination of treatments that can help them live their lives a little bit better.
Yes, and I thank you for it so much. What are some things that most people don't know about your work?
I think one thing is I think they know there's long hours, and they usually cross into what most people would see as family time, evenings and weekends. So there's definitely that component. It also 95% of it is very routine. Like the 5% is the terrifying, what are we going to do?
Oh.
But most of it is we see a lot of common things all the time, so we get really good at dealing with those as well.
So what are some of the scariest or the most memorable moments you've had so far?
I think with children, it's always the scariest, especially if they're really, really unwell. Those are probably the scariest and the worst points that I've seen.
Okay. And since, we're in pandemic and a lot of people don't really know what COVID is, can you tell us what COVID truly is?
So COVID is a disease caused by a virus, the SARS-CoV-2 virus, which, as we know, started out in Wuhan and has now spread throughout the world. It's spread through close contact with people. It may be spread also by aerosols, so the coughing and staying in a room with someone who's coughing, who's not wearing a mask. It causes a respiratory illness, an upper respiratory illness, so you can get initially, runny nose and a sore throat and a cough, but it can progress to something much worse, where your lungs become very inflamed, your body can start shutting down, you can develop blood clots. That's usually in the second to third week of getting it, but not everyone goes there. Some people will only get a very mild illness or no symptoms at all. And frankly, you never know who's going to get really ill and who isn't. It's nobody knows what the factors are. It seems older folks or people with certain comorbidities do worse, but that's no guarantee.
Okay, so that leads me to, what are some of the myths about this virus?
That I think there's a large group of people who believe that masks are pointless, that this is all a conspiracy to take away your rights, which is ridiculous. Like there's no, most of us would happily love for that to be true, but it sadly isn't. And right now, the ICUs in Ontario are filling up quickly.
Yes.
Markham Stouffville itself yesterday had 9 ICU patients to admit.
Oh, wow.
This is a place that only has 50 total beds. So in one day.
Right.
That tells
so
me
the numbers are increasing.
If that happens every day, there's going to be no room. Like my chief told me that maybe in 2 to 3 weeks, they're going to run out of space and we'll have to use the operating rooms as emergency ICU beds.
Oh, wow.
No one gets surgery. after that.
Right, because you can't even admit people into surgery with that around. Okay. So what are you and other medical professionals doing to prevent like further spread of this disease?
A lot of it comes down to public education. So especially around the holiday season, we're really encouraging people not to gather and follow the guidelines, try to stay within household. It's going to be tough for a lot of people because, this is a time for getting together and for spending time with family. But,
Right.
I think it's something that needs to, especially in hot zones like we are in the GTA, that back away from that this year.
Okay. So one, wear masks. Two, try not to social gather, and stay away from each other during the holidays.
Yeah.
What do you think of the vaccine that is all over the news now? Do you think it's a go? Do you think people should take it? What are your thoughts?
I think it's there's a lot of people who are worried because it came out so quickly and it uses a lot of new technology. One good thing is people like me are going to be the guinea pigs, so we're getting them in the next few weeks.
Oh.
And some of my colleagues have already gotten it in emergency rooms. Like an emergency doctor colleague of mine just got it in Montreal today. So if anything bad happens to us, you'll find out soon. So.
Oh no! But you guys are also the front line. We can't live without you guys.
But we went through. A lot of us went through the data. Like it was published. It's very transparent, and it looks fairly safe. Like there's minor risks here and there, but it looks really, really, really safe. And anyone who's seen COVID in the flesh, if you've actually seen people who get it seriously, you would not hesitate to get this vaccine. You would, if you had to get poked in the eye, you would take it because that's how bad COVID can get. I would rather take the vaccine in the eye than get COVID.
That's a statement for sure. I was watching one of the Senate, I guess on CNN or something, and there was a doctor that was saying that we should look at our medication that we already have to treat COVID. What are your thoughts on that?
Well, there's not that many. Like there's maybe just steroids if you get serious COVID, but there's not that many treatments. Like they just approved a drug from Eli Lilly, and then there's another one from Regeneron that you can give in the first week. Okay. There's not much else really that you can give that's proven.
Okay, so it's another possible myth out there.
Right.
Okay, so since we're right before Christmas, what do you urge people to do and don't do? That's the last thing.
So firstly, I wouldn't go to a crowded shopping mall. I think those are closed in the GTA anyway.
Yes.
Do delivery as much as you can. This means groceries, anything. Like I haven't been into a store in 4 months.
Okay.
When I go to a gas station, I use the ones that use tap for paying.
Right.
And I wear a glove when I use the pump. You have to rearrange your life to avoid other people, unfortunately. And when it comes to gatherings, try to do it virtually. I make a rule with my family to talk to my parents and my siblings every day on video chat.
Okay.
And that we're actually seeing each other more this way than we did in real life.
Right.
Get that habit going.
Yeah.
Exactly. So if you get that habit going, you can lighten the sadness of not seeing them in person. But it's just, we'll make the next holidays twice as sweet as this one. That's the way. But we all need to get through this. It's like we're at the finish line, but there's a big hill to climb before the finish line. But you can see the finish line, and we're almost there.
All right. Well, those are all really, really great tips. And I really want to thank you and let you know, and all the other frontliners know that all of us appreciate it. Again, Dr. Pirzada's information will be on our website. He will be posting blogs if needed, extra information if needed. And if you or anyone else want to be featured on Park Bench, please contact me directly, uchu@consultant.com or 647-271-5376. Thanks again, Ms. Dr. Pirzada.
Thank you.